blah, 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 blah about my patient, the doctor's going to say, what's their blood pressure? What's their heart rate? What's their temperature? And you're like, I don't know. I didn't take their vital signs. So that we just can't do that, okay? Vital signs are a part of our assessment. So that is the first thing that I'm going to ask all of you to do. General survey is really just inspecting your patient for their appearance, their clothing, their whatever. So she doesn't have any points for that. I'm assuming that you are doing that. You're inspecting your patient as you meet them, okay? Under observing LOC, I'm going to show you that I'm just going to introduce myself to my patient and I'm going to ask them their name, if they know where they are, do they know what day it is? So they are alert to person, place, and time. I am not going to do short-term recall or long-term recall. You would not do that on every patient unless you suspected that they were disoriented or that you needed to pursue that further. So under LOC, all I'm looking for is, does the patient know their name? Do they know where they are? Do they know what date it is? Okay? And you'll get the 5 points. Under skin, you're not really going to be saying to me or the patient, I'm assessing skin now. So as you're doing the assessment, you are observing your patient's skin tone, turgor, texture. I might ask you a question like, in an older person, what kind of skin would you expect to find? Okay? And you'll get the 5 points for skin. I'm not worried about, I'll show you when I do the assessment how we do that. Okay, moving on to head and face. She has here that she wants you to state all the cranial nerves and what they're associated with. And what I said about lab stays in lab. But we do not do this on a daily basis on our assessments on our patients, okay? If I suspect a nervous system problem with a patient, then I will test cranial nerves. But a general baseline assessment, I do not do this. I don't ask my patient to smile, frown, show me their teeth, blow out their cheeks. We don't do that. Unless I'm a neuro nurse or a neurologist, okay? I'm not typically doing that. So I'm going to show you what my expectation is for head and face, okay? And it kind of flows through, and I'm going to go out of order a little bit, so I apologize for that. But when I'm assessing a patient's head, I'm looking at you. I'm looking at symmetry. I see that your eyes are symmetrical, your nose is okay. I am going to ask my patient to do perla. I'm going to use my pen light, and I'm going to assess their eyes. And I think she has that on the next page. So I do want you to do perla. When I'm looking at a patient's head, I do perla first, and then she has the 6 cardinal positions under eye. I do want you to do that. In the hospital, we call it EOMI, eye ocular movement intact. The clock, remember I take my pen and I have your eyes follow me out into the 6 different positions? I'm going to do that and I'll show you. Okay, so those 2 things I want you to do for eyes. I take my pen light, I look in my patient's nose. I take my pen light and I ask my patient to open their mouth and say, ah. And I look at their tonsils, their teeth, their buccal mucosa, their uvula. Good. And I'm going to show you this in a sec, so hopefully it'll make more sense. So I'm sorry if I'm jumping around, but head and face to me include all of that. Okay? I look at my patient's ears. I might palpate them, just compare left to right, okay? I do want you to palpate your patient's sinuses, okay? And I'll show you how we're going to do that. I do want you to palpate lymph nodes, and I want you to start with post-auricular. I want you to do pre-auricular. I want you to come around and do the mandible, correct? I want you to come into the cervical lymph nodes, and then I want you to move out across the clavicle. So I do want you palpating those lymph nodes. We would do that. Okay? Sorry if I'm jumping around here. I'm not going to test my patient's sense of smell. I'm at the bottom of nose and sinuses. Now I'm at the top of the second page with mouth and throat. So I've already looked in my patient's mouth. I do not want you to test each other's gag reflex. We're not going to do that here in lab. We don't do that in the hospital. If our patients have a problem with swallowing, we would assess that, okay? We're not going to do that here. You could ask your patient to stick out their tongue and say, ah, just so you can see the tonsils and the uvula in the back. I already talked about eyes. We're going to do perla, and we're going to do the EOMI, the 6 cardinal positions. Okay, I talked about ears. Ears, I do not want you doing the whisper test. We don't do that in hospital, okay? And I'm sorry to keep saying that. But if I suspected a problem with my patient's ears, I would assess further. But for a baseline assessment in the hospital, I'm looking at their ears. I'm asking if they have any problems with their ears. And just to note, all semester we've done focused assessments every Thursday, right? And we've done the subjective information, and then we do the objective. While I'm doing the assessment, you will see me ask the patient questions, because that's typically how it runs in the hospital. We don't do them separate. We sort of do them together. So while I'm assessing someone's ears, I'm asking them, do you have any problems with your ears, any problems with hearing? So you'll hear me say those things. That's a good way to get the patient focused on your questions, so they're not so much worried about what it is you're actually looking at, okay? But we're gaining information as we go through the systems, okay? So cue me if I miss anything. You can let me know. Does that make sense, what I just said? Okay. So eyes, ears, neck. What I want you to assess with the neck, I talked about lymph nodes already. You certainly can inspect that your patient's trachea is midline. I do want you to palpate their thyroid gland, and I will show you how we do that. I'm not concerned about this carotid, auscultate and palpate the carotid pulse. That's a cardiovascular assessment. It doesn't belong under neck. Okay, it really should be part of cardiovascular. And we typically don't auscultate people's carotids unless they have cardiovascular disease. We will typically just palpate a carotid pulse, and I will show you pulses when I go to the heart. Finish up with pulses last. Okay, make sense so far? All right, then shoulders, arms, hands, and fingers is not really a system. And I see under here that she wants you to assess and palpate and do some cranial nerve testing. Honestly, we don't do any of that. The only thing that I will do under shoulders, arms, hands, and fingers, I will show you that I do capillary refill on my patients. I will test strength. I'll have them grab my fingers and test strength, and I'll do the same with feet. I'll have them do strength, and I'll do capillary refill in toes, and that's it. Okay?
Toes.
So as long as you do that, I'm happy with that. This is the exact assessment you would do in a hospital, okay, or you would do next semester with your patients, and that most nurses do in a general, med-surg environment. Respiratory, really important. I do want you to auscultate breath sounds. I'm not concerned about AP diameter. I'm not concerned about all the stuff I see here. You're looking at your patient. You're observing them. You can see whether they're breathing quickly. You've taken their respiratory rate already. You can observe and inspect all that. I really want you to know how to listen to breath sounds, and I'm going to show you the 2, 4, 6, 8, 9 places I want you to be in, mostly posterior and one place in the front, and that's exactly what you'll see done in the clinical setting. Okay? Any questions about respiratory? All right, so you would get the 10 points for that if you auscultate correctly. Moving on to the heart. The only thing about heart here that I really want you guys to know, we're not going to expose our bare chest to each other. Okay, in the hospital, your patient would be in a gown. Here in the lab, I really just want you to know where you're listening to heart sounds. I want to see you do the places. I want ape to man done for me to observe that you're listening to heart sounds in those areas, okay? And you would do that in the hospital too. I don't want any palpating or percussing or any of that under heart sounds. I want you to be auscultating heart sounds. That's huge. That's the only thing I really want to see under heart, and you'll get the 10 points for that, okay? Abdomen, I'm going to show you how I do inspect the patient's abdomen. I do want you to auscultate the 4 quadrants, and I'm going to show you that. Under palpation, we are not going to do deep. I only want to see you do light palpation, okay? And I will demonstrate. And then legs, feet, and toes is really not a system, but I see where she's getting at here with moving down the body. You've already inspected, you've already assessed capillary refill and temperature and all that. I have my patients stand at the side of the bed, and I'll do the Romberg with the balance, and then I will have them walk for me, and I will observe their gait, and I will palpate the pulses, and I will show you those. Okay, so that's all I want you to do under that system, and you'll get the 5 points for that. Okay, now she wants you to mention during your assessment what's normal, what's abnormal. Honestly, if you remember to do that, fine. I might just cue you and say, when you're assessing lymph nodes, should you be able to palpate them? If you tell me yes, I'll be like, are you sure about that? Okay, so that's what I'm considering, you knowing what's normal, what's abnormal. Should I be able to palpate a thyroid gland if it's normal? What's an older adult's skin going to assess like? Those kinds of things, okay? Because she's giving you 5 for each, so I'll come up with a question and ask you if you don't mention it, because you're going to be so focused on doing it right that you're going to not be able to say, well, in an older person you would do this, and, okay? So I'll ask those 3 questions. Does that make sense? Okay, 15 minutes. I'm going to do an assessment. on one of you. I'm gonna be back here. Let's see, I need a table. Get my stethoscope a sec. I don't think this bed's down all the way. So let me move over it. So I do need somebody to be my patient. Who would volunteer?
Why not?
Come on over.
I want to lay on the bed.
You always want to lay on the bed. So Kim is my patient, so I'm going to walk into Kim's area here. Oh, she already sat down and made herself comfortable. I was going to tell her to do that. I'm going to say good morning, Kim. My name is Lisa Hathaway. I'm going to be your nurse today. I'm going to wash my hands, and then I'd like to do a brief physical assessment. I'm going to take your vital signs and just see how you're doing today, okay? Okay, how are you feeling? You're okay? What hurts?
My jaw.
Your jaw. I see a little. What happened here?
I had my wisdom teeth out.
Oh, I had that out for nursing school too. So, are you just taking him for pain? No? And what's your pain? Some cold spot pain on a scale of 1 to 10. What would you say? On a scale of 1 to 10, 1 being not at all, 10 being the worst pain ever. Where do you fall? A 7. Ouch. You need something for pain here, right? So, oh no! Oh no.
No.
I have some stuff with you.
Yeah, I have some ibuprofen on me if you want.
Oh, I have that.
Alright.
Yeah, we all got our meds.
Wow, terrible. Oh, she's gonna sit this way? No, I kinda need you over here, I'm sorry. Sorry. Okay. So I wanna see you introduce yourself to your patient. I would provide for privacy, but I want you guys to see what we're doing, so I'm not gonna close the curtain.
Just in time.
I washed my hands and now my fingers are gonna be really cold.
Sorry.
Okay. So the first thing I'm gonna do is take your blood pressure and temperature, so I'm gonna scoot up here on the bed. Do this first. And can you tell me your full name? Okay, do you know where you are today? And do you know the date? Okay, good. So I just checked LOC while we were chatting there a sec, right? She knew her name, where she is, and what the date is today. Temperature's 99.8. Okay, you need something for pain and some fluids, huh? TPR, right? So, sorry, my hand's a little cold. I'm going to take her radial pulse. Oh, and you want to wear a watch. I have my giant watch on today because we can't see the clock over there, right? So, I'm going to take her radial pulse. I'm not going to do this for 30 seconds for you to sit there and watch me, okay? But I would count for 30, and then I would leave my fingers here, right? And I'm going to count her chest rise and fall for an additional 30. So I've just taken her TPR, all right? Next, I'm going to do her blood pressure. I'm going to be able to get that through your sweatshirt there. Sorry. You don't have to take it off, you know, just leave that like that. That'd be great. Okay. Oh, I'm so sorry. It's got the, careful taking it. Just put my pulse there. Just gotta have the rest on it. Lift it over here. So you do a 2-step, right? Blood pressure. Honestly, I'm going to use my diaphragm. My notebook says too, but I hear better with this, so. Oh, we're losing our cup. That's a good pulse there. About 102 over 54. Is that normal for you? All right, good. Okay, so I got her TPR and BP. Good, that's part of general survey. I've observed her, I asked her LOC. The next thing I'm gonna move on to, can I ask you to move your glasses for me a sec? I'm just gonna check your eyes, I'm just gonna have you look at me. Take mine off so I can see it. I'm gonna shine a light in your eye, but you just focus on me, okay? Good, okay, so I just did Perla, and now I'm gonna ask you to just keep your head facing me, but I want your eyes to follow my head, okay? And I'm doing the 6 cardinal positions now, right? And she's good. Am I going too fast? All right, great, good job. I'm just gonna take my pen again and just look in your nose. Are you having any issues with breathing through your nostrils? Feel stuffy, drainage, anything like that? Good. How about we take a look in your mouth? Can you open and say, oh, the best you can? Yeah, tough to open your mouth when you have
Stitches on.
stick your tongue out, or is it? Okay. Take a look at your ears. Any problems with ears at all? Any earaches, ear pain, ear drainage? Okay. And you wear glasses for far vision or near? Okay. Okay, next thing I want to go to then, I've done pretty much what I want to do as far as head and face are concerned. I'm going to palpate your sinuses, so you know I'm sorry, I need to have you take your glasses off again. I forgot that. So let me do that. So you just let me know if you feel any pain or pressure when I push here. Pain or pressure? I'm not going to because of your teeth. I'm not going to push too hard here. Feel a little bit of swelling over there because of it. Okay. Next I want to do lymph nodes. I'm going to ask you to get your glasses on a second. I'm going to start in the back, behind her ears. And move to the front. Bet you I'm going to find some in the cervical there. Okay. All right, you can get your glasses back on now. Last thing I want to do up here is I just want to check your thyroid gland. So now you should do from the back. I'm going to kind of do it from the side. I like to use my landmark here, right? And I move just up above with 2 fingers to palpate here. And I want to ask you to swallow, if you can swallow. And I did not feel her thyroid gland. Okay, good. Let's see, what else do I want to look at when we're sitting? I think we're pretty good. Oh, you know what? Check your. Okay. Your other ones. And if I had shaken her hand when I introduced, I would have felt the skin temperature. Okay. I want to listen to your lungs. I'm going to do that from the back. I'm going to ask if you'll take some deep breaths each time I move the stethoscope, but you'd have to do a like that, okay, so I can hear it. Now, it might be tough with, I'm not going to go under her shirt. Typically, if we're in the hospital, you want to go on patient's skin. I want to just do it right over, but just so we make sure we hit the right spots, right? So, I want you to start. Can you take a deep breath for me? Again. Again. One more time over here. Your mouth out through your nose. One more time over here. Now I'm just going to listen once in the front. My stethoscope here. Let me take a deep breath. Good.
Where did you have
No.
this stethoscope the last time in the front?
I have it just right here, tracheobronchial, right in the center. Yeah, you know, honestly, I know that there's lots of places in the front that the book tells you to listen, but you're going to hear heart sounds and epigastric sounds, honestly. So when I'm listening to the patient, since most of the lung fields are in the back, if I've listened at the apex all the way to the bases in the back, I have a pretty good sense that their lungs are, you know, what's going on there. But I always listen in the front just once here to at least get the larger tracheobronchial. If the patient has asthma or if they have something going on in the bronchioles. Okay? All right, so now I'm going to listen to her heart sounds while she's still sitting up. And I'm going to start. And just this time I'll just have you be quiet so I can hear your heart. And once I hear love dub a few times, I can move on. of. And if I was gonna do an apical rate, that's where I would do it, where I finished up. So, 2 spots here, over to the side. Everybody good with where we listen to the heart? Okay. I think I might have you just lay down, okay? Make yourself comfortable. And do you want me to raise the head up a tiny bit, or I'm gonna raise the bed up to see my back. And the side rail's up opposite of me, so she's safe in the bed. Okay, is that a little bit better? So now, you just put your hands at your side. I'm gonna take a look at your abdomen. I'm just gonna pull this taut. Now, honestly, if we were with our patient in the hospital, I wanna see a bare abdomen, okay? But right here in the lab, I'm not gonna do that in front of your entire class. So, the first thing I'm doing is just gonna look at contour, and then next I wanna auscultate, and I want you to know where you're supposed to start with that. And listen to, you hear some gurgles, vowel sounds. Okay. Sounds good. Any problems with valves, HPA, upset, gas, or I'm just gonna push a little bit on your abdomen. You let me know. You let me know if you feel anything or light palpation in all 4 quadrants, okay? You're just feeling for tenderness. The patient complains or flinches. She looks relaxed. It's not something to be bothering her. Okay? And that's it for your abdominal assessment. And then I would move down and I'm gonna check, we check brachial pulse, I would check a brachial pulse here, we check radial, I would check a radial pulse here. The next pulse, we're gonna defer femoral because I'm not gonna expose that part of your patient partner, but we would go to the, what's this one behind the knee? Heel, right, so you wanna feel both of those, okay? And then I'm gonna move down to, what's the pulse that I would feel here if I'm not going to take her breath off, but we would. So we're going to feel those pulses. My favorite.
Dorsales pedis.
Pedis, good. I want to feel both of those. And if you can't honestly feel it, let me know that because the Doppler's sitting right there. I'll have it out and you can try the Doppler on your patient and get their pulses, okay? Important to do that. I would take my patient's shoes off. I'm going to capillary refill each toe. Okay? We want to look at our patient's feet. It's important to do that, okay? All right, good. Now, a little neuromuscular assessment is gas pedal against my hand. Push as hard as you can. Good job. You doing the other one? Good. Okay. Try it now on this one. Toes to your nose. Good. Toes to your nose. Good. Grab my fingers. Squeeze, 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 squeeze. Hard as you can, hard as you can, hard as you can. Good job. Okay. We're almost finished. I'm just going to put the bed back down. I can do a couple more things and we're done. Okay. Any questions or... All right, you want to sit up on the side of the bed for me again. I'll have you stand a sec. Just put your arms at your side. Just comfortable, normal posture. Just close your eyes for me. And I'm observing. Right, Robert? Okay, great. Now, I'm going to ask you to walk over to me. And I'm observing heel, foot, toe, arm swing, posture. Swing it around, head back the other way. Okay. I think we're pretty much finished for today. Everything looks really good to me. Is there anything I can answer for you? Questions? Or, well, it's a pleasure to meet you, Kim. I'll pass the information on to you. Okay, thanks. Done. Okay? Did I miss anything? So in that little bit, how long did it take me?
10 minutes.
15 minutes?
14, 15.
So in that time, I was able to get her vital signs, listen to heart sounds, lung sounds, assess her abdomen, her pulses, her gait, her posture, her strength. That's a lot. In 15 minutes, I got a great baseline on her. And if I found a problem, I would then explore. Like, I would definitely explore. She complained of pain. She's got a bruise on her cheek. She told me she had her wisdom teeth out. She could barely open her mouth when I tried to assess inside. So you would, go a little further. But everybody good with that? It's easy, isn't it? Easy breezy, okay? All right, so that's all I expect next Thursday on your patient partner, okay? Do you have questions for me, anybody? Can we practice that then on our partner? Did everybody sign up? And really, that's it for today. That's the expectation for today. That you feel comfortable doing that next week, because I do want to see you do vitals comfortably, proficiently, because you're going to do them now next semester every day on every patient. I want you to feel comfortable with bowel sounds, with cardiac sounds, with respiratory sounds, because you are doing this now. This is, your basic nursing assessment. Okay? All right. Thank you.